Hello again, it's 15 minutes to 5. This is the third and final hour of the Wednesday edition of Today here on eNCA, DSTV Channel 43 with me, Dan Moyane. Now let's bring you this story. A new report is highlighting how foreign nationals were affected by government's response to the COVID-19 pandemic. Overall, it found that there was a lack of political will in helping to ensure that foreign nationals in the country receive the required support and assistance. Well, to tell us about it is Paddington Mutekwe. He's a researcher at the Center for Social Change. Paddington, good afternoon and thank you very much for your time. Just first up, overriding question, when did you do this research? I mean, the first hard lockdown was in March 2020 and only recently we came out of the national state of disaster. What period was your research?
Okay, good afternoon, Dan, and good afternoon to the viewers, and thank you for the opportunity. Yeah, so this report, the time frame stretches from around March when the lockdown was introduced and up until March this year. So you realize that much of the time we were in the hard lockdown, so I only managed to collect the data last year. And even in that period, I had to do online interviews. So you find out that I couldn't really move around. So I had to collect data using online data methods, that is interview via Zoom as we are doing with you right now, and some document analysis.
Okay, let's just go through. I haven't read the report. I haven't read the full report. I've just seen a high-level summary. But you group the challenges into three categories: protection, health, and socio-economic crises. Can we just tell us what were the challenges the foreign nationals face around the issue of protection?
Okay, thank you very much. So around the issue of protection, there I talk of issues to do with access to documentation, issues of xenophobia, and also the issue of stranded foreigners. So if we talk of access to documentation, I think you agree with me that during the pandemic, most of the DHL offices, our offices were closed. So most of the foreigners couldn't renew their documents, and as such, in the end, they end up having invalid documents in the country, and this had a negative effect on how they accessed healthcare facilities. So some of them, in the end, they ended up being turned away from our public hospitals because of their documents. And also when the lockdown relapses, when some of them, I think around level 3, when they could repatriate to their countries, and they reached the borders with their expired documents and they were declared undesirable, which in the end, end up with them bearing a fine. Some of them got banned from entering the country and so forth. So those were some of the challenges around access to documentation. And also on the issues of xenophobia, we also had xenophobic, incidences in June. And I think most of this also stemmed from some of the statements by our public officials, politicians, who are influential people in high offices, who uttered the statements that were discriminatory in nature and in the end fueled xenophobia. And some of these xenophobic attacks also stemmed from, some of the Twitter accounts that were spreading information, which also, resulted in foreigners, not being tolerated in the communities.
So I guess the health crisis would have covered the question of documentation and would have also had an impact in the health side of things, because if you don't have an ID or any valid documentation, you wouldn't get vaccinated.
Yeah, that's very true. That's very true. So that also had a bearing on how they access, healthcare, healthcare in the public sector mostly, and even the issue of the vaccine. So most of them actually got the opportunity to be vaccinated late last year and early this year. So you then realize that some of them missed the opportunity to be vaccinated along with locals when, everyone else was getting the vaccine.
Yeah, you also found that
the other issue.
Yeah, sorry, yes, Paddington, the other issue.
Yeah, the other issue also had to do at the initial, during the onset of COVID-19, the initial, COVID-19 testing form, required South African ID numbers, and it was also exclusionary.
Okay. You also found that, what could have been exclusionary was the way the health messages were disseminated. The foreign languages did not come into it. There was no translation of very key public health messages And in your research, you found that was identified as a problem for foreign nationals during the pandemic.
Yeah, that's very true. That was also one of the major challenges. And also even the issue of languages when foreigners, are speaking to our healthcare providers. But again, on the issue of translation, I would love to applaud the work that was done by Lawyers for Human Rights in the African diaspora. For my participants, they also testified that they tried to fill in that gap by translating some of the key information into some of the languages, spoken by foreign nationals. So that was a gap that, our civil society tried to cover.
Thank you very much, Paddington Mutekwe, to sharing with us some of the findings of his research report investigating the challenges that were faced by foreign nationals in South Africa during the COVID-19. Basically, overall findings suggest that there was a lack of political will by the South African government or from the South African government in helping to ensure that foreign nationals were catered for during the necessary relief measures during our national state of disaster brought on by the pandemic.